Okay, record on this computer. Good.
Yes, I can see the recordings come up. Well, that's all the tricky bits all done, except for the silly Facebook business. I've done all the tricks that I'm supposed to do.
How did you manage to do 119 interviews with all these challenges?
Yeah, well, I'm only 25. Yeah, I know. It's it was rough. Oh my goodness, it's been hard.
I can imagine.
There's no euphemism for that. Okay, so yeah, there's only been a couple of salmons which have crossed over the boundary to catastrophe, and we've managed to streamline and become reasonably prepared for a lot of these events. Like, for example, I had one this morning, actually, for the one that was supposed to be last week, and that was cancelled through a catastrophic event. So I had to wing that. But I caught up again this morning, so I'm actually having 2 salmons today.
Oh, wow.
But that salmon wasn't streaming to Facebook. This one, I'd like to get the participation of the audience. It's always good.
Yeah, absolutely.
Now, let's see. There was a chat message that came up. Now, for the viewers that have registered online, someone sent a chat message. When I lost my computer, I also lost the chat history. So if you can, please send the chat message to me again, and I'll read it. Okay, let's have a look. No, Facebook is out. Gosh. Try it every which way. Never mind. Okay, well, you've got a lovely tan, Elmar.
Thank you very much. Yeah, it's quite sunny here.
Where are we?
We are in the south of England, between Portsmouth and Chichester.
I don't know. I can't say I know the place, but I'm surprised it must be in the countryside, right away from all the London. Well, even London's not that dirty, really.
Well, we're actually very, very close to the sea. So
yes,
it's on the coast.
Wonderful, wonderful. And you'll be it's autumn now, isn't it? So the weather should still be reasonably balmy.
Well, it's from, I would say, Tuesday, it was really, really nice. Got warm again because the Monday wasn't that nice of weather. But yesterday, well, I was in Germany yesterday visiting my mom. So, yes. But the weather there and here was really lovely. So, good. And I hope it goes on for a few more days, and then we'll probably get hit by autumn. Yeah, absolutely.
Yes. When London had the heat wave, did you also get the good weather?
I think we did, yes. I mean, London is always a bit different because, I mean, there's a lot of smoke, and they say actually London is one of the most polluted cities worldwide.
Oh, no, I'd question that.
But I think there are many more cities that are far worse.
It's a lot more polluted, and there's other cities which are even more so, like Beijing. It's incredibly bad, really bad.
Wow.
Gosh, I'm saying that. So no, it's and I've been to London. London was
like a summer breeze.
It was. I could see in the distance. Whereas here, you know, on a bad day, you can't see more than a kilometre. You just can't. It's white. Mind you, they've had clean air the last couple of days. I think they've stopped the factories in preparation for the October the 1st celebrations. Maybe.
I mean, they have so many options nowadays what they can do with the weather. I think we had that here when the Queen celebrates something over the Olympic Games here. You always wonder why in those events the sun is shining.
Really? They do the same thing, do they?
Okay. Well, I don't know. I could just imagine that it's such an important day, so it shouldn't be messed by bad weather.
Right, right. Okay, now while we're dilly-dallying, I should be getting my introduction sorted out. Well, why is that not moving? Here we go.
Do I have to do anything from my side now?
No, no. At this stage, you just have to smile as these people come online. Now you've done everything. The things which I'll be asking you are things which you would have questions you've been asked in the past, which is like, why is oral hygiene so important, and what sort of things can happen? What are the nasties that can happen?
Yeah.
For this program, I'd like to have a bit of personal experiences thrown in there and anecdotes, examples, because we try to relate to the everyday person rather than a professional audience.
Yes.
We want to raise the awareness of people.
Yeah, absolutely.
No, okay. Facebook is not going to happen. I'm not even going to try. There, gone, closed, off. Good riddance, I say.
So
More
how does that
important,
work now then? We just
no,
recorded.
well, yes, we've got two video channels. We've got our channel on YouTube, of course, but we've also got our private channel, which we have about 15 or 16,000 people viewing. But YouTube's got a good spread, so we get out there and throw the message out.
Okay.
Gosh, yeah, 120 views.
All those people who come through Facebook, will they be redirected to YouTube, or how does that work?
Well, if I could have got the live streaming broadcast, a little box comes up and our smiley faces go inside the box, and there's words and noises as well that come through on the box. It is true live streaming video onto the Facebook channel, and it keeps there for a while.
Mm-hmm.
And now Facebook is quite large and growing all the time. We advocate health and wellness and good breath and oral hygiene, of course.
Yeah. Yeah, it somehow gets more and more restricted on the search engines, for example. If you look for vaccinations, I think you have to nowadays dig very, very deep to get to what you actually want.
Yes, and you've put a statement into a question form again, so I see you're following through your habits from when you wrote your book. Yeah, that's right. Well, it's very much the case, where Spooky Tours Rife treatments, and now if you do Rife equipment, you've got to wade through 1 or 2 pages of people that are rubbishing the claims.
Yes. And
stating the RNA claims without giving any sort of evidence before you get into the meat, which is a shame. Because it's intentional, isn't it? It's the way the world's going. But let's try and oppose these forces and let the goodness happen. Okay, well, it's time to start. Are you ready to roll on your side?
Already, yes.
Okay, well, I'm ready as well. So we'll kickstart this off. Hi, everyone. Welcome to SAMA, a weekly program which invites experts each week to discuss a topic. I've screwed that up. You can tell, can't you? It's my tongue. I'm not a good talker, and it's the end of the day, so we'll do it again.
Well, if you could then just wait a second, then I could go quickly to the loo, because I just felt that might be a good idea.
Okay. It's lucky we've got Kai to edit for these little instances. Well, that was a good start, wasn't it? Okay. Elmar sounds like a nice guy. I'm going to have fun in this interview. Hey, don't forget, there's not many people online, but please ask those questions. We need to keep the gosh, he was in such a hurry, the charts go. ask the questions, because now you've got the expert online. Now's your opportunity to find out all these things that you've been asking, or you've been wanting to know. I mean, okay, I see a lot of new faces on here, a lot of fake people I haven't recognized as being on Summer before. Welcome aboard. Now I'll stretch this out a little bit so I've got my chat box come up. There we go. Right. So go.
All right, sorry for that.
Okay. So it's more than just words that are flowing. Let's get this started, shall we?
Yes.
Hi everyone. Welcome to SAMA, a weekly program which invites experts each week to discuss a topic from their area of expertise. This week we are delighted to have Dr. Elmar Jung as our expert to discuss the importance of oral health. Early on, Elmar realized that treating symptoms is the most common approach that dentists and doctors take now to tackle illnesses. Convinced that there must be a better way, Elmar embarked on a remarkable journey to explore complementary diagnostic and treatment methods that offer a whole person approach. Over the years, Elmar has witnessed firsthand the damage that poor nutrition and toxic dentistry can do to a patient's health, and the transformational changes that happen once they get it right. His main goal is for his clients to be in charge of their own health and well-being, and to raise their awareness about the influence dental materials and treatments can have on their overall health. Dr. Jung is a qualified holistic dentist with the German Association of Holistic Dentists, a Doctor of Ethics Mayo Medicine, and a German naturopath. Welcome to our show, Elmar. It's fantastic to have you with us.
Hello, John. It's an absolutely pleasure, and thanks for having me with you.
Let's start off in the deep end. Nothing's coming out right. We'll try and get it right from now on. Let's start at the deep end. How important is oral health?
I think oral health is a very, very, very important part, and I think it's very much underestimated, underrated in terms of the whole medicine, because we have a lot, some say up to 80% of, for example, chronic diseases that could originate or at least be triggered by problems in the mouth. And the mouth, there are different areas where the problems can then be happening. So yes, absolutely, to answer your question, it is a big, big issue. And the oral health, I mean, it starts in the mouth and it ends where the poop comes out.
Yes.
Because that is the whole area of digestion. And yeah, as I said, it starts in the mouth.
So how can it be a problem if people brush their teeth? Most people brush their teeth maybe once or twice a day when they get up and when they go to bed.
Yeah, it's a good idea to have a really good hygienist or hygiene, so that you clean your teeth and every single tooth appropriately. However, the main important thing is not only the hygiene, it's about what you feed yourself, because that is actually what determines your health. And there are lots of people who don't brush their teeth properly, but they have a really good health and they don't develop decay. Because the real issue with tooth decay, for example, is not the bacteria, as we are always told. Yes, the bacteria play an important part, but they are not the original problem. The problem is actually our diet. If our diet or stress, for example, limits our digestive system and we have a problem there, then the alkaline acid balance of our body gets out of balance. And Steinman and Leonara, he or they they discovered that there is a fluid flow from the inside of the tooth to the outside. So from the pulp through the dentine into the enamel, out into the oral cavity. And as long as we have a balanced life, then this fluid flow keeps going. But if
Um,
we're, yeah,
within the tooth, you're saying a flow within the tooth.
within the tooth, yeah, it's like a
Oh,
self-defense from
isn't
the
that
body.
amazing?
And as long as it flows like that, then no bacteria can actually come in. It's only if you have a problem, if you have a bad diet or you are very stressed or something happens, a trauma in your life, then this fluid flow can stop or even reverse. And then when it reverses, then the bugs are brought into. So the bugs, the bacteria, they are just opportunistic. They take what they're given. And we have to be honest. I mean, we're a lot of bacteria in ourselves. So without bacteria, we just wouldn't be here.
Right. Can we just have a quick 30-second break? My lighting, it's getting into the late afternoon now. My lighting's gone down. So this will be another editing moment for young Nick. I just turned some lights on.
Okay.
It's only going to get worse. Okay, I've got the Gestapo lights on. Let's do it.
There we go.
Okay, it's quite an amazing concept. I never actually realized this. There's a flow through your teeth,
Yes.
from. Is that amazing? So there's normally like a positive flow keeping the bacteria out.
Correct. Yes. I mean, the tooth itself is not a stone or a solid structure. It's filled with miles and miles of tiny little channels. So we have the main channel or the main channels if there's a tooth with more roots, 2, 3, or 4 roots.
Yes.
Then we have the main channels, but the tiny little channels, they are 2 to 3, some say even 6 miles long per tooth. So, and that is where proteins are, where this fluid flows, and that is also where bacteria can hide.
Right. Isn't that remarkable?
Yeah, it's absolutely amazing. And so therefore, if you look into teeth like that, then yes, you appreciate that people clean their teeth properly. However, it would be more important to educate that it's the food that they put into themselves that makes the difference. And obviously, how good is their digestive system working?
What foods are good for your teeth?
Well, for the teeth, the first thing is obviously that the less sugar, the better. I don't
Everyone
think there's a I don't I don't think there's a diet that fits all, because there are people who thrive on raw food. I'm not really good on raw food. I find this not the ideal food for myself, but I have quite a lot of raw food with my diet. So I think it's about what feels good for you and what you have experienced that can make a difference to your life. And I think
Right.
there are a couple of basic things, like nowadays with the wheat, with the gluten, I don't think that's a good idea. We need to look into fats. Good fats are very, very important. So that's an important part. The main thing is definitely sugar processed foods, because in processed foods is a lot of sugar, a lot of fats that we don't really want.
No. I've had a question come in from Lucy. It's a good one. It's a good timing to pose it to you now. Lucy says that she's seen a lot of videos on the body's ability to replace adult teeth. Now, you've just said that teeth aren't rocks; they're like a living organism, a living part of your body.
Yes.
So, can adults have their body replace their own teeth that have come out if they're healthy enough, or if there's some, if they're, is it possible? Is really what she's asking.
Well, I've heard from people who have done it. I've never seen proof of it, so I myself have no experience with it. and I would be really, really happy to see who has done it and how they've done it. I
Yes,
mean,
yes.
it's since I started at university, I've heard that you can start regrow your own teeth, or they will find something that they place into the jaw to regrow your teeth. But until now, I haven't come across anything that could make that into high street practices.
Okay. Another thing that a lot of people talk about is mineralization of teeth. Where if your tooth has got a cavity, you can
Yes.
do something to allow your tooth to rebuild itself.
Oh yeah, and again, that is down to nutrition. And Ramy Nagel wrote a really good book, Cure Tooth Decay, where he points out what kind of food he recommends to do that. He came to that because his daughter, I think it was, had a lot of cavities, and so he went on this search. He's a journalist. He went on this search and found out which foods were good. Now, from a healthy person's point of view, to keep your teeth healthy, I think it's important to have good lot of vitamin C, vitamin D, vitamin K, and obviously magnesium, because the magnesium then is important to really make the vitamin D and K work properly.
Okay. Wow. Another online participant is asking, how can vaccines and heavy metals, which would be amalgams, excuse me, affect tooth health? Do they block the mitochondrial channels?
Well, that's one thing that they do, and we also know that mercury has an issue or can cause issues in the gut. So when the
Yes.
gut doesn't work properly, again, as we discussed earlier, then we can have a problem with the teeth.
Right. Okay. So vaccinations, same thing?
Well, vaccinations, I mean, there are really two worlds clashing here. The ones who are totally for it and others who are totally against it. The problem, I think, is that there are so many different things in a vaccination that aren't really helpful, like the thiomersal or the aluminium. So we are treading here quite dangerous land.
Okay. But with regards to oral health,
Yes.
what is the impact that a vaccination would likely have? Just on the science side. You've mentioned the aluminium.
Well, I
Would you?
haven't had any scientific papers on that.
Okay.
What I think is really that when we have a mercury in our gut, that we then can have those problems, because the mercury makes or can make antibiotics not work properly, and obviously it makes the bacteria then go into different forms.
Right. Well, now vaccinations are pretty much compulsory unless you're you want to if you love going into battle. So what can you do after the event? Can you do anything to try and nullify the detrimental effects of the vaccination?
Well,
This is with regards to going to the teeth, not regards to other things, issues.
with nutrition, you definitely can do a lot, and with supplementation, that's for sure.
Yes.
The question always is, how does the person react to the vaccine? What do
Yes.
we actually see on the
Right.
teeth? And do we then put it in correlation to the vaccination?
Okay. Okay. So what foods are good for tooth health? What kinds of food?
Organic food, for example, I think
Yeah.
that's the main thing, that we look into the way how our food is grown, how our food is processed, and the least processed it is, the better for us,
Yeah.
because then it has all the goodies on it.
Mm.
And and nowadays, yeah, the problem is with the big farming. They have lots of pesticides and herbicides, so they
Right.
go into the water, they go onto the crop, and then this is what we get, whether it's through our tap water or in the actual food, in the tomato, in the whatever you eat.
That's right. It draws in all the toxins,
Yes.
the fertilizers, other undesirables. Right. What supplements would you recommend for people who want to have good oral health? Would these be the magnesium, the
Magnesium, vitamin D3, vitamin K, zinc, selenium, and um, boron is a very important one. That is
interesting?
good for bone health. Um, vitamin A is probiotics as well. The the real problem what we have nowadays is that even if you have your food all organic, then you still, from my experience, need to supplement because we just don't get everything from our food nowadays, even if it's organic, because there's not enough in the soil
Right.
to get into the crop.
Yes, it's sad. I blame overpopulation for that. Not enough goodness to go around. Yes, it is a sad situation. Even if you do buy organic, which means no sprays and poisons put on the crop, it doesn't guarantee that it's got all the essential minerals that are required for good health.
Yeah, and the minerals are really the spark plugs of life, so to say.
Yes,
So without
yes,
the minerals, nothing really works. And I mean, we see that when we do surgery, for example, the patients, they really go on a 2 to 3 weeks advanced supplementation program so that we know that at least for that period of time, they have those supplements. Ideally, when they come and have a nutritionist or health practitioner who thinks along the same lines, that is the best way to do that. And then during treatment, we have high dose vitamin C infusions, whether that's for mercury removal or for surgery. And I think that is a very, very important part because not only does it help with the pain or with the healing, it also does a detox. And
right.
so, with all treatments, I think it's very, very important to have vitamin C infusions. And if you can have vitamin C infusions after that locally, there are a couple of um, providers for that. I think that's a very, very good thing, especially when it comes to winter now, just to give you a little boost. So vitamin C definitely very important, and then keep going with the supplements for another 4 to 5 weeks after the surgery, and that has proven very, very beneficial for the patients.
Perhaps if
Especially
they
the
start.
vitamin D3 is important, the K and the magnesium.
Now, D3, would you, if you're fortunate enough to live in the southern coast of England and you've got enough sunshine, would you still need to have a vitamin D supplementation?
Well, I always have my clients to have the vitamin D level checked, and most of them are very, very depleted. We had
You talk,
one who had about 16 micromole per liter, and the average where the NHS says is okay, I think is around 50.
okay,
So I want more than that for the bone health because it's a very stressful situation for the body, and you need to have a lot of those supplements there, especially if you didn't have them beforehand. So
okay,
it's important to really go for full supplementation in that regard, and that's what the patients are getting, a dental bone regeneration protocol to make
okay,
sure they do that.
okay. So it's not vitamin D, but vitamin B. Is that right?
Vitamin D3, vitamin D3, delta
D,
3. Yes,
delta 3, roger that.
yes, yes.
Okay, okay. Now, what, okay, another question has just come in. How much vitamin C is given during the infusions intravenously? How many grams would
Well, that
typically?
depends. Normally, you could say 22.5 to 25 grams. And a really good ratio also is 0.75 grams per kilogram body weight.
Okay, Okay. I didn't think there'd be many doctors that provided that service, even though it's something that's so simple. I've heard instances where people have been in hospital during an emergency, a medical emergency, and they had to go to the point of demanding the injection, which is sad, but considering vitamin C is, and what is there to lose? The person's on the deathbed, so what can
Yeah,
you
it
do?
has quite miraculous properties, the vitamin C. I think it's absolutely essential, and it's cheap if you compare it to other medicine.
Maybe that's the answer.
I don't think you can actually patent it. That would be
Yeah,
an issue.
that's the thing. Yeah, that's the issue. So, but there are doctors in the UK and other countries that do this, in other Western countries.
Oh yeah, I mean,
Like,
they're getting more and more. We're a bit pioneers here, but Germany, for example, there are doctors who do that as well, and in the States, definitely. It's a growing community of biological dentists, that's for sure, because the demand is there from patients.
oh,
It's
absolutely.
amazing how many people nowadays know so much about things, and that is where Facebook groups, for example, the Nico group or Lime group or whatever group, um, they exchange their experiences so they know what's happening. And yeah, with the advent of the internet, this is a great thing. So you have far better educated clients to talk with, which makes it easier in a way.
Sometimes it's misinformation, unfortunately. And we were discussing this just
Yes.
before the show, where several good industries are being hammered through manipulation of search results. The Jeremy Ball asks, can liposomal vitamin C be used instead of intravenous vitamin C?
Well, yeah, it can be used, and I ask my clients to go threefold with vitamin C: the oral, the liposomal, and the vitamin C as an infusion.
Yes.
Thomas Levy, he once claimed, I don't know whether he still does that, that the vitamin C as a liposomal is as good as the vitamin C infusion. I haven't seen proper studies for that, so we'll stick with the infusions and give the liposomal on top.
Okay. With the infusion, it's directly into your body. You're bypassing the intestinal tract
Correct.
and therefore eliminating any chance of injury that a high acid substance will do on your oral tract.
That's correct. And it's the same with the liposomal. So you have
Too dangerous
two ways
potential.
of
Yeah.
going into your body. Yeah.
Right. Now, what sort of things could happen if you've got tooth problems for the rest of your body?
Well, in the early days when I started out and I still had my practice in Germany, I had a patient coming in, a 13-year-old young girl with her mum. They were booked in, and I remember that if it was yesterday, really. It was a lovely day. They sat in the waiting room, tears coming down their cheeks, and they didn't know what to do. And the reason for that was that the little girl, Christine, she was supposed to be locked up in a mental institution because GP and headmaster didn't know what's going on with her. Since 6 months, she lost her memory, she retained water, she was treated with antibiotics, with corticoids, with all sorts of things. She had pain all over the body, her digestive system didn't work properly. She couldn't go to school, she had to stay at home. She was really, really in a bad way, depressed, almost suicidal. And now they say, you need to go into a mental institution because you're a fraud. There's nothing wrong with you because no test, nothing did show anything. So nothing's wrong with you. What you're doing here, you're just making these things up to gain attention.
Mm,
And I mean, looking at the girl, nothing could be further from the truth.
right.
And I sat her in the chair, had a look when she opened the mouth, and I knew exactly straight away what was going on, she had a tiny little amalgam filling in her mouth. Now, this small amalgam filling wasn't what was the real cause, but that was the last drop into her bucket that brought it to the flooding. So her mom's mouth was full of mercury. So during pregnancy, during breastfeeding, she detoxed herself into little Christine to bring her full of mercury. And so, with the father also having a lot of mercury filling, this is something that Boyd Haley once found out, that when mom and dad have a lot of mercury fillings, it's highly likely that the children have a problem with detoxing. And that was exactly what we were presented with this young little girl. So, we started a very, very gentle detox program, removed the small amalgam filling, and within 3 months, she was back to normal.
Gosh.
So she would have stayed in a locked up institution for the rest of her life because no one would know what happens. And yeah, because it's a lack of knowledge, isn't it? If you don't know where to look for, you just don't look.
That's a very scary story too, because there would have been a lot of cases where they would have gone
Yes.
through the institutions.
Yes.
Just the removal of the amalgam and the detox regime.
Yeah.
That's all
And
it took to
I
swing
think, yeah,
her.
that's a very important bit. It's great to have the mercury fillings removed. However,
Yeah.
because mercury fillings leak 24/7, and you can measure that, therefore, it's also important that you do the detox, because over the years, there's so much mercury coming out of the fillings that will then, depending on where you have your weakest spots, settle in kidneys, in gut, in your brain, in your spine, in your thyroid.
Yeah.
So yes, absolutely, detox program is definitely very, very important.
And this detox program, is that the vitamin C plus?
Well,
I
vitamin C is part of it. And
yes.
before you can actually do a detox, you need to make sure that the patient's detox organs, the excretion organs, that they work properly.
Yes.
And I have to emphasize this very, very much, because oftentimes people do a detox, but the kidneys don't work, the liver doesn't work, and their gut doesn't work properly. So they mobilize a lot of those toxins, and then they just go around in the body and stick to some other organs, but can't get out of the body. So therefore, it's very, very important that this is done with someone who knows exactly what they are doing, with a naturopath, with a health practitioner, GP, whoever has experience with that, so that those channels are opened up first. So when it's then mobilized, that it can actually be taken out of the body.
Right.
And
Right.
that's what we see a lot of times, that the gut, again, is the real culprit. The gut with most people doesn't work properly. And it's an easy test. How much toilet paper do you need? If you need a lot of toilet paper, then your gut doesn't work properly, because normally you shouldn't use any, or shouldn't need any toilet paper. So that's a very easy way to answer this question for yourself. And so therefore, it's important that the gut is cleaned. Colonic irrigations, enemas, things like that are really, really helpful to make sure that the stuff that sits there gets out. And it's amazing what comes out. I just had a couple of colonics over the last few weeks, and yeah, it's fascinating.
Fascinating. I've never heard that word in the same.
Yeah, fascinating, because you think you have a really good diet, you do your detox, you have your supplements, you do enemas, and then you go for a colonic, and there's still so much old stuff coming out.
Gosh. A question's come through from Jeremy again. Is there a life to mercury fillings? You said that they emit mercury. Does the amount of mercury that they release reduce over time?
Well, yeah, it
And then
will reduce because it's not that much in it anymore.
So after, well, he poses the time frame of 50 years. If you've had amalgam fillings for 50 years, are they then less dangerous as when they're first installed?
I mean, we had clients from all walks of life, from all ages, and when there were 60 or 70s and we tested, there was still, with a lot of them, a lot of mercury coming out of very old fillings. Most fillings, most amalgam fillings are placed when they were in their youth, and so they were in for decades, and there was
Yes.
still a lot of amalgam mercury coming out of them. So it might be reduced, but there's still a lot coming out.
Okay. Okay. Oral health. What sort of is it gum diseases which are more dangerous than tooth decay?
Well,
For
like tooth decay, gum disease is nothing that strikes from random. It's something showing that fundamental problems are occurring in your body, because it's not a localized issue most of the
right,
times. It's again something that has to do with your gut. So you need to look at everything. Obviously, it needs to be clarified that there's no plaque, no buildups or hygiene treatment. But a surgery, for example, for gum can only succeed when the underlying causes are really addressed. And most of the times, it is something to do with the gut. And if we go a bit further, then if you have gum problems, then you lose a bit of your hold in life. So you could also look into more emotional issues that could be related to that. And that's the great thing again about tooth organ connections. So we have meridians running through the teeth. The Chinese have those meridians since thousands of years, and two Germans, Dr. Voll and Dr. Kramer, they attached teeth and to those meridians, which is a highly interesting topic.
they matched the Chinese
Yeah, they
meridian.
matched the meridians and put teeth. So, for example, the stomach meridian that has the upper molar teeth as a tooth connected to them, and is also connected to the thyroid, is connected to the breast, to the mammary gland. So if there's a problem on this meridian, then the tooth could suffer, the thyroid could suffer, or the stomach. It's not a one-way street, it's either
Right,
way.
right. So if you get a tooth extracted, which is a common procedure for people that are having their teeth, not enough room in the mouth for their teeth, that could affect other organs in their body.
Well, we're
That could
touching.
explain a few problems up here because I've had teeth extracted. Uh, is there an association between the teeth in your mouth and your the hair on your crown?
Well, there's definitely a connection. I mean, if a tooth decays, if a tooth gets infected, then obviously the best method is to have it out so that the
Yes, sure.
infection is gone.
Mm,
When you talk about removing teeth to make space, which normally happens with young children at the age of 14, 15, they say there are too many teeth for a too small mouth, but actually it's the opposite. It's a small mouth that needs to be more widened, and that could start very, very early. So what I did with my young patients is when they're 6 or 7, we see that the habits like thumb licking and these kind of things, that they are ruled out, and then broaden um, the jaw bones. And a very important part for broadening your jaw bones starts very early in life, actually, when you just come out of the womb with breastfeeding. So a good breastfeeder has less likely a too small mouth when the milk is sufficiently supplied. So
interesting.
that's a very important bit, because the sucking of the nipple is an important part of developing proper swallowing and also the developing of the jaws.
I wonder. if that's the reason why there's been an increase in dental issues, because now both husband and wife have to go to work, so the babies feed from a bottle.
Yes.
Is
And I
that is
mean,
that
they all almost drown when they drink from a bottle because the hole in the bottle is oftentimes far too big. So they don't really learn to swallow properly. And if they don't learn to swallow properly, they don't breathe properly. And if they don't breathe properly, the sinuses aren't developed properly. So they are set up for sinus issues, allergies, asthma, all those sorts of things. So it's very, very important that already, well, it starts even earlier so that the mom gives proper nutrients to the child so that they come into this world with a
right?
good foundation. And then the,
Sorry.
you go on.
Oh no. I was just going to pass comment that teats are quite often hard. They're hard rubber or hard silicon, and that can't be good for the mouth formation as well. The shape of the mouth must change, I guess, when they're using a teat on a bottle.
Oh yeah.
Yeah.
Yeah, the whole sucking process, swallowing process with a normal sucking device doesn't work like the nipple.
Yes. Wow.
So very
I,
important for young moms to make
I
sure they,
never. Yeah. Yeah. Well, I knew that breastfeeding is good for the antibodies being passed from the mother to the child, but there's so much more. And this thing, you're stuck with with the mouth for the rest of your life, a certain way, formed a certain way because of the way that you drank your milk. I never
yes.
knew that. It's absolutely gobsmacking. It's important. Why don't
Oh,
more people
absolutely.
realize that?
It is. Well, unfortunately, we don't get told that at university. Like we hardly ever, I think, I don't really remember that we had more than a few hours of nutrition, if at all, which is the basic, well, the foundation of real healthy living.
No, well, nutrition goes against um, the business models of various industries. But and I was thinking when you're talking about the supplements, how before surgery you give them the intravenous C,
No,
and
that goes during the surgery. The vitamin C goes during. While
during
I
this,
do the surgery or the amalgam removal, they have the infusion.
and they have a supplement regime beforehand.
Yes.
I was thinking if they did that regime a few years prior to this, they wouldn't be having to lie down and have these bright lights shining on them and someone with a sharp knife just hovering above them.
Well, it could well be because then, for example, with fatty degenerative necrotic jawbone infections, also called cavitations, they sometimes happen when the teeth are extracted and it doesn't heal properly, and not healing properly could actually, as you just mentioned, be that they are not sufficiently supplemented with the proper nutrients. Absolutely.
Right, right. What role does emotion have? You touched on this just a little bit
Mhm.
earlier. And what kind of emotions? And how can people encourage that type of emotion in an environment which just steams of conflict?
Okay, I had a few patients who had to come for surgery a couple of times for cavitation surgery. We did 2, 3 surgeries in the same place, and it never really healed. Once they addressed their emotional issues in that from that area, so let's say you have a large intestine, a molar on the lower, one of the big teeth, so that is connected to the large intestine,
Yes.
and one of the emotions for the large intestine is letting go. So looking into that, what is going on in your life that you don't let go, that's a big part. So they then looked into their emotional state and resolved things, and we did another surgery and it healed. Now you can say, well, it could have been something different, but I mean, we did many things differently from surgery 1 to 2 to 3, and only the fourth when they then actually address the surgery beforehand by looking into their emotional state, then it actually made an impact. And so nowadays, I really ask them before we do surgery from these areas, is there anything? I have a tooth chart where they can see positive and negative emotions. And I don't want to know what's going on. It's just about them looking at it, and then sometimes something crops up, and sometimes something comes up a bit later, and sometimes nothing comes. So, but it's very, very important emotions, because in the end, what are we having? What are we looking at disease when we look from a bit of a further perspective? It's our body telling us something. Look at this. And so we probably have been angry for a long time or depressed for a long time. And then you don't resolve that. And so the body has to take more severe measures to show you in a certain area to look at that. I mean, we're getting here into a totally different medicine, and I think it's important to be open for these kind of thoughts.
Yes. There must be a booklet that the SEMA experts are sharing, because I think it's 3 or 4 consecutive SEMAs we've had experts say the same thing, how basically it all starts with emotion. Like you've got to be in the right frame of mind
Absolutely.
before the healing can really start. And you've seen solid evidence of this post-operation.
Yes.
It's absolutely, I think you guys are trying to tell us something.
No, it's really cool. And you had Renzo Celani on your show the other day, and I use his mirrors with my tooth chart, where I
Yes.
have the emotions on and the meridians on, and kind of transfer that to the patient. So they sit on their on these plates, and then I use the mirrors on those teeth, and it's amazing how much better people now heal. I had another client. She had always problems, was falling into a deep hole after surgery for a week. She's off, she can't do anything, pain. And we treated her with the mirrors, and she had nothing like that at all. And just last week, I had another patient, and she was really, really terrified of the whole procedure. And she was one of those patients who got informed about almost every single step we take, which was great. So she knew what's coming, which frightened her even more, obviously. But then she really was expecting pain. She was expecting swelling, and
Yes.
nothing happened. She's really, really happy that she got rid of that tooth and didn't have to deal with all the supposed consequences. So yeah, I'm absolutely sure that what Renzo Celani developed with his mirrors with the light kinesiology is absolutely amazing. And
It's
I
interesting.
use it in my health consultations as a health consultant. We run through a program there where we get rid of so much stuff in one session, in probably about 1.5, 2 hours. It's really great. And in the end, that should be done before you do any intervention like surgery or amalgam removal, because then the body's really capable of dealing with that in a far better way.
It's amazing. It's
Yeah.
absolutely amazing. And it's good to hear someone who's actually using his system, because I mean, he was, yeah. So I'm hearing it from both angles.
Yeah, I mean, I did the course in February and then started on
oh,
myself, because I always do the things on myself first before I
yeah.
give it to the patient. I want to know what's going on. Yeah, I walk my talk, so to say. And I've done it. I've been there. I had cavitation surgeries, and I had my mercuries out and the detox. So I really know what I'm talking about. And I think this is very important, because then the client also feels that there's authenticity, that you really can feel with them. You know what you're talking. You're not just reading it from a script.
Yes, yes. Jeremy's asked a question. I think we've answered this one before, just a little bit earlier. Can cavitations heal without surgery? if other factors such as diet or emotions are dealt with? And the answer was a yes.
Well,
As I,
as of now, I haven't seen a cavitation healed without surgery. That doesn't mean
oh,
it
yes.
hasn't happened. I'm pretty sure that with the mirrors, we're on something very special there. Um, I know from Philip Mollica in the States, he uses ozone treatment. So
Mm,
he brings ozone in the cavitation, and he says that he can heal the cavitations with that. I've done that for a while, and I think it holds the infection, the inflammation there. But I don't think that if you don't remove the cause,
yes.
you will get rid of the problem. And Dr. Hans Lechner from Germany, I mean, he is researching on that topic for decades. And he also says at the moment is the surgery.
Okay. Okay. Right. The healthcare products which people can buy from supermarkets, are they good? Are they suitable for the job? If you brush your teeth using toothpaste you'd find in a supermarket,
Well,
would they
if
be
they have a biological and organic corner, you might be lucky, yeah.
okay?
Well, I don't think that you need sodium lauryl sulfate, for example, in your toothpaste. It's not necessarily you use it for cleaning the floors, but I don't think your teeth are that dirty that they need that sort of material to do the job. And actually, you don't really need toothpaste at all. Toothpaste is a great thing to give you a better taste in your mouth, and you have the feeling, yes, I've done a good job. But actually, you could do that without. And there's a really fantastic toothbrush, the blotting brush, that works totally without toothpaste. And it works like when you look at a painter and he has this oil painting and he has too much oil on the canvas, he kind of blots on the canvas, so removes the oil from it, and in that way the blotting brushes work. They have split ends and they suck the debris from the teeth. They were developed by a dentist in the States, Dr. Phillips, and he had fascinating results with his clients. None of his clients had to go or undergo surgical treatment for their gum problems. They all kind of blotted their problems away with the blotting brushes. It's fascinating, absolutely fascinating. There's still a video of him on YouTube. I think Tooth Wizards, they have the video, and that's also where you can get the blotting brushes. It's a very old video from the, I think, 1960s or something, but he explains it so really understandable. It's absolutely brilliant. And so,
Okay,
yeah, you don't need toothpaste.
so blotting brushes aren't new. It's an old technology.
Oh, I mean, Dr. Phillips actually got the idea of blotting brushes from an Indian tribe where he went on holiday or something, as he explained, and they used these twigs um, from neem trees. And he thought, oh, if they get it out with that, I can try that with a toothbrush. And so he developed the blotting brushes with that kind of technique in mind.
So it's blotting BLOTTING.
ING, yes, correct. Blotting brushes and toothwizards.com.
Okay,
They sell it.
okay, well, that's two things for us all to Google afterwards.
And they have
Uh,
the ones, the big ones and the small ones. I like the small ones because you can get in any area that you like, and the small ones obviously are more suitable for children.
I assume that you still need to use dental floss for your teeth. Is dental floss a good product to use?
Well, if you do it properly, it can be of help. You just need to be very careful that you don't force it into the gum, then it does more harm than good. And Dr. Phillips actually said if you use the blotting brush properly, then you don't need a floss. And there are already studies out from universities that they say the um, the floss is overrated.
Interesting.
Yeah,
So they say. You've
so they
heard
say.
that.
Yeah.
That's actually amazing. Blotting brush. That sounds so incredible. You just dab it on your
Yes, you
teeth.
just dab it and you suck it out or rinse it under the sink. I just suck it and swallow it.
Oh, it's goodness, isn't it?
I mean, the bacteria are there anyway. You just get away with them. And the good thing with the blotting brush also is you can do it on borrowed time, so to say, because you can just sit in front of the telly or when reading a book, you just blot away, and you don't really have to stand in front of the mirror over the sink like you have to do with the toothpaste.
Carmela Walker has joined us. I wonder when you're going to join us. She's a stalker. Says you can buy them in Australia, Queensland, for $5.95. I'm definitely going to get one. Definitely going to buy one.
Yeah,
I was going to ask you, is it just an American thing? Because I've never heard of it.
great. Yeah.
Now, if you have mineralized toothpaste, do the minerals do good to your teeth? Do they get absorbed by the teeth and make your teeth stronger? Yes, we've all seen these animated advertisements for the all-time health product fluoride, making your teeth strong and healthy. Well, we're skipping over that little detail. Can minerals be absorbed by the teeth?
Well, if the teeth are not solid organs,
Yes.
absolutely, they can absorb things.
Okay.
I think the more important bit is that it comes from the inside through the bloodstream, that the blood is saturated with those minerals so that it can give it from that perspective. Because what we said previously with the self-defense with a fluid flow from the
Yes.
inside to the outside, as long as that
Yes.
works properly, then obviously nothing could come in.
Right. Right. Are there any foods that you can take foods which you, when you consume, blocks up these channels?
Blocks up. Well, I would say very sweet ones that stick to the tooth.
Right. Right. Okay. Okay. Which, of course, is very conducive to plaque and decay and acids.
Yeah, and again, then if you have a healthy alkaline acidic balance, then it doesn't really make much difference to the tooth because it has its self defense up, and so the tooth is protected.
Right. I think we've covered all the bases, haven't we? We've done the blotting brush, which is amazing. I'm definitely going to buy one if I can.
Yeah, they are really good.
When people have a crown put over their tooth,
Yeah.
are there long-term health repercussions as a result of that?
Well, it depends on many things. Depends how much tooth has been removed to place the crown, because the more tooth material that has been removed, the more likely is that the tooth gets a trauma from that, and in the worst case, it dies, needs a root canal or
Gosh.
taken out. Then the
Yeah.
other thing is, does the crown fit properly, or are there gaps so that secondary decay can develop?
Right.
That's the thing that is important on the tooth itself. Then what
Mm.
material is the tooth crown made from? If it's a metal, nowadays I think with all the EMFs coming more and more onto us, I think it's more and more important to have a metal-free mouth. Also, if you have, for example, amalgam fillings and metal crowns, then you have a battery in your mouth. So there will be a battery or current flowing from the amalgam filling to the more precious crown
Right.
through your saliva, and that is why some people taste this metallic taste as nothing
Yes.
else than tasting the metal out of the mercury fillings towards the crowns. And what we also sometimes see is a tattoo around the precious crown, nothing else than a tattoo of the mercury that came out from the filling and now being placed in the gum there.
Oh my God! Well, that's proof positive, isn't it? The
Yeah,
mercury's moving.
yeah.
Gosh, that's scary. That's incredibly bad.
Well, it gets worse. If you have a mercury filling and you have a dead tooth, then the dead tooth produces mercaptan, and the mercaptan will then be made into, with a mercury from bacteria, into methyl mercury, which is one of the most toxic substances on Earth. So, yeah.
Well, bacteria is in everybody's mouths, so wouldn't that substance be in everybody's mouths if they have amalgam to varying degrees?
Yes, that's correct, but not everybody has a root canal treated tooth or a dead tooth.
Okay, okay,
So
okay.
it's a combination of those two.
But I'd say a lot of people would.
That's correct.
Wow. Well, we're getting closely to the salmon. I'd like to have things on a positive note at the closing. I just put this other question to you that Carmen has asked. Now, I'll read it to you verbatim. She asked Dr. Jung, please correct me if I'm incorrect. Is not the tooth enamel clear? When the body is becoming healthy, then the tooth pulp becomes white again.
The tooth pulp.
Pulp. I always thought the tooth pulp was red.
Yes, it is red because this is where the blood vessels are,
Right.
the nerves and the lymph.
And the enamel is clear, but that's the very, very outer shell, isn't it, of the tooth?
Yes.
And then you've got this.
I mean, people have different colors of their enamel. And yes, he is right that when the tooth is more healthy, then it can go back to the original color, because then the tooth also detoxes. And that's what I've actually seen when I did oil pulling for a couple of months. I think I did it for 3 or 4 months. My tooth shade actually got at least 2 or 3 shades whiter. So the tooth, the oil pulling pulled the whatever was clogging up the teeth there, pulled it out, and the teeth got whiter. Obviously, I stopped, and then it got yellow again, but that showed me that it works. So, and it's an easy way to do it.
It is. What oil did you use?
At that time, I used sesame oil. Nowadays, I probably would use, because it's always, well, that's what a lot of people say, it's better to use the coconut oil.
Okay. Okay. I love sesame oil.
Yeah, it has a lovely taste to it.
Oh, it's fantastic taste. They make their own sesame oil here in the farms in China. The family who I am, and they grow sesame, and they reap the seeds. They whack them out with long sticks and roast and extract the oil. It's an amazing.
I mean, that's the thing with making something yourself. When you just mentioned that, you can do your own toothpaste, for example. You use a bit of baking soda, put some hydrogen peroxide in, 3% hydrogen peroxide, a couple of drops, and Celtic sea salt. If you want, use some essential oil, and you have a fantastic and very natural toothpaste.
And it'll be quite cheap, wouldn't it? It's not.
Oh, absolutely. Yes, very cheap. The other thing is you have to disinfect your toothpaste. So buy a big bottle of hydrogen peroxide, best food grade, 35%, and then put your toothpaste in that, leave it in for a few minutes, and then rinse it. That kills bacteria. And once you have been ill, just swap your toothbrush. Yeah. And you should change it anyway every, I would say, 4 to 6 weeks. If you don't clean it, at least.
I change my brush every 2 years whether it needs it or not. That's right.
Well, there are families who share toothbrushes, so
that's right. It's more, the mileage is more important rather than duration.
Yeah.
Jeremy's asked the question: are oral irrigators effective?
If you use them properly, I'm not a big fan of them, because a lot of people start misusing them, which means that if you have an oral irrigator, you need to make sure that the beam of the water, that this goes parallel through the teeth. You do not point it down into the gum area. If you do that, you could destroy the fibers that hold the
Yes.
gum to the tooth, and also
Right.
you push down bacteria, food debris, and all sorts of things. So used properly, it is a helpful thing. I have never propagated it.
Okay. Okay. Great. Okay. Can you think of anything positive to say?
Yeah, I think
With
that everyone really has the capacity and also the determination to do things right, and with information that is out there, information that we provided here on the talk, or what they can get from my little book, Shut Your Mouth and Open Wide, you get an understanding of the connections, how everything is interrelated, that we are a network of organs, that everything what you do on your toe has a repercussion somewhere else in your body. And I think as soon as we understand this kind, or yeah, get get used to this kind of thinking, that it's not still the Newton thing with cause and effect. It's the human body is far more complicated, and we're nowhere close to really know everything that's going on. So by embracing this kind of thinking, I know that a lot of people will embark on a journey, that they will become healthier, and the information is there. The doctors, the dentists, the practitioners are there. They're waiting for you to come. And the dentists, doctors who aren't open to that, I think the patients will just go to the ones who offer those services. So it will come from the patient that we get a even further paradigm shift in that. It will not
yes.
come from the practitioners, because if you've done work for decades, you will not on your last 10 or 15 years change. So you need to be open to that from your personality point of view, and then you will go with your patients, go on that journey, and it's a constant learning curve. Things you haven't done 5 years ago, and other things you will probably never do. So it's a discovery journey for us as practitioners, as well as for the patient. And it's always important to look into it from a point of view: what does my body, my soul, or however you look at life, want to tell me with what I'm facing at the moment?
Mm, mm, mm. I noticed that book in the background. That's titled "Shut Your Mouth." Is that your book? I
That's my
just have
book,
it
yes.
casually thrown on the back shelf facing the camera.
That's
Great.
that
Great.
is it. Shut your mouth and open wide. It's 120 pages and very easy written, and you get a good overview and an idea how this connection works. And
Yes.
I mean, it's a really good one. There are a couple of others: Toxic Dentistry Exposed, from my colleague and friend Gray Munro Hall, and that goes into far more specific. So if you start with Shut Your Mouth and then go to that, that's probably a really good progression. Then obviously
Yes.
there's the root canal cover up from George Meinig, who brings up what um, Weston R. Price discovered in the 1920s, and he wrote the book Nutrition and Physical Degeneration. I think those are, so to say, my Bibles in
Yes.
terms of basics of good dentistry and good nutrition.
Right. That's right. It all starts from the mouth.
It all starts from the mouth, absolutely, yeah.
Is there any website that people can go to if they want to learn more
Yeah,
from
my
what?
website is www.dr, that's Delta Romeo hyphen Elmar. Elmar is Echo Lima Mike Alpha Romeo hyphen Jung, that's J for Julia Uniform November Golf.com.
Great.
And there's also a tooth chart on their website on the top. And so you can have a look if you know you have a root canal treated tooth, or you have a tooth that causes any problems. You just click on the tooth, and all the relations, or a lot of relations with those meridian, with this meridian comes up, and so you can see if there's anything in that meridian pathway that bothers you as well.
Yeah, it's not just a coincidence that things happen after you've had tooth surgery. If there was a choice between a root canal or tooth extraction, just as a final question. Oh, look, this person's asking how to read a tooth chart. I wanted to have the last question. Are tooth charts easy to read?
Yes, it's
Okay.
photos, so you don't have to read a lot, you just watch and look at the pictures.
And it says which side is, when it says the left, does it mean like your left?
It's always the patient's.
Or on the patient's perspective?
Yes.
Okay, great. Okay, I've often wondered that. I better start driving on the other side of the road then. A choice between root canal or tooth extraction. What would you go for?
Well, it depends. You need to see how good in health are you. The problem with root canals is they are always giving up toxins. So I personally would never want a root canal, or if I had one, I want it out. However, there are circumstances where this is not possible for the moment. And so if the person is in good health, they will, and I say this, compensate. But how long can they compensate? They can compensate as long as the bucket fills, and then
that's right.
No one might think of that root canal treated tooth anymore. So for people who suffer from any kind of chronic diseases, I would definitely have the root canal taken out. And the reason for that is the experiments that Weston A. Price did in the early 20s last century. He implanted, for example, a root canal treated tooth from a patient who had rheumatism. And the rabbit developed exactly that kind of disease. So he implanted the root canal treated tooth under the skin of the rabbit, and the rabbit developed that disease.
That was the source.
That was the well. That it just shows, not necessarily what it the source, but it shows that those root canal treated teeth gather these toxic elements and are then a reservoir to poison your body on an ongoing basis. And that's why I say, if you are healthy, yes, you might compensate those, but they will never be good for you. They might be good for reasons that you can put a bridge in or whatever, but from an overall health point of view, I think the root canal needs to be looked at with far more scrutiny.
Right. And of course, someone may be fit and healthy when they have the root canal done, but 20 years down the track.
Exactly. Yeah, that's the point. And we need to bring more awareness of this network thinking, so that, because a lot of times people say, well, but I don't have any pain, it's not swollen, and I don't feel anything wrong. Absolutely, you don't. But that doesn't mean that there is nothing going on. That's why we call it silent inflammation.
Right.
And there's a really good machine that has been on the market for quite a while, the Cavitat scan. Unfortunately, it's not produced anymore. However, Dr. Johann Lechner in Germany, he has now developed a new machine, not yet on the market, but hopefully will be soon, the Cavitao. And we can very clearly determine the density of the bone. So we know when there is a low density under the root canal, for example, we know there is an inflammation infection going on. The bone has lost its density. And if you have that, then you know when you take the tooth out, for example, you shouldn't put an implant in straight away if you're on the side of implantologists. However, it shows you exactly where those problem areas in your bone are. So that's a fascinating method of determining, and it works with an ultrasound, so there's no radiation with that. So that's a really, really good thing to know and to show patients that there is a problem going on. Something else is the orotox test. The orotox test is a very, very simple test where you have a paper point and you bring the paper point between the tooth and the gum of the tooth. And the paper point then sucks up the fluid that surrounds the tooth, and you leave it there for a minute or two and then put it into a special solution. And after 5 minutes, you can check how toxic is that tooth. And most of the times, those root canal treated teeth are high or very high toxic.
Gosh.
So that gives the patient an idea with what he's dealing, because otherwise he would just have to rely on what you tell them. And if
Yes.
they actually see,
Say
oh wow,
positive.
yeah, it is really, really toxic,
Yeah.
then
Wow.
that gives them a better idea in their decision making.
Wow. An vain attempt, I should say, at being the last person to ask a question, Jeremy's he's asking 3D X-rays, are they better than, he's written caveat scans. I've never heard of caveat scan.
I probably, caveat scans.
Does he mean CAT scan? CAT 3D X-rays?
No, I think he means cavitat scan.
Oh, okay.
So as I just said, the cavitat or the cavitao, they determine the density, the bone density.
Yes,
so
yes.
We often see that the x-rays don't show anything. It's just our experience looking at the area that we suspect there is something, and a lot of the times then we find huge cavitations, and this is where the cavitat scan, he writes it there, cavitat scan, yeah.
Yes,
so
yes,
the
yes.
cavitat scan is in that regard far better than the CT scan. The CT scan has their properties and benefits, but for that particular issue, the cavitat,
Yes.
the cavitao, better. Yes.
Okay, great. And Carmela's, we're trying to stop the Emma. Carmela, she's, is she correct in assuming that the body is capable of absorbing fungus and is capable of regrowth and reproducing, like a garden? It's actually a nice way of thinking of it, isn't it? Like a garden, but it's
well, I think we humans have huge potentials. We just don't know how to tap into them. So
we learn very slowly.
Yeah, I think if we wait another few thousand years or something happens to us, then we get all our capacities, and then we can do everything with our bodies. I'm certain for that. However, at this moment in time, we're a bit limited still.
Yes, and your example that you gave with the tooth transplanted into the rabbit, or into the rat. Rabbit, and the toxins were then transferred from the tooth. So the reservoir of the toxins was the tooth.
Yeah. And the really interesting thing was they then took that tooth out of that rabbit and implanted it in the next and the next, and they had to implant it into 35 rabbits until there wasn't that reaction. So there's a lot of toxins in one single tooth.
A lot of toxins. Wow. Okay, we'll call it a day. Thank you so much for coming on to our show. Well, it's great, you know, when there's people, when our participants participate and ask these questions, because
yeah, it's great. Absolutely, this is what makes a seminar.
And this particular one's been very, very insightful. That you've dropped a few bombshells. There's a few things I've got to look up now, and yeah, it's blotting brush. It's a must-have.
I think so too, and I recommend it. I even have it on my questionnaire. Do people know about blotting brushes?
No. All we know is these brushes with bristles.
Yeah. There's one more thing. I think that's a pretty big bombshell. I've heard from a colleague from Germany. He is doing a lot of infrared, or did, he has now retired, infrared photography. And he did infrared photography when people used electric toothbrushes. and it looked very, very bad. So the bone changes as if there is an infection and inflammation going on after they brush their teeth with a ultrasound toothbrush.
Ultrasonic or
Ultrasonic, yes.
only
Ultrasonic.
ultrasonic, not the rotating bristle ones?
No, no, I don't think they do much, but the ultrasonic, yeah. Yeah.
And of course, the ultrasonic, they're the top of the shelf toothbrushes. They're even better than the rotating ones.
Yeah.
Once my 2 years was up, I was going to change my brush to one of those. So, yeah, I'm so happy.
Get the blotting brushes.
I could brush my teeth on the way to work.
Absolutely, yeah. Well, I never say it, but you could do it. Well, at least when you sit in the passenger seat, let's put it that way.
I guess to use an irrigating device might be a little bit difficult on the way to work, because they can be quite dangerous, can't they? They're quite
well, and it will be probably very messy.
A bit messy as well. That's right. Thanks for coming on board. Thanks for.
It was an absolute pleasure, John.
Very
Thank you very much. Thank you.
Okay. You take care. Bye-bye, everybody.
Bye. Bye-bye.
Bye-bye. Yeah, that was good. I thank you so much. I really have enjoyed it. I like your sense of humor. I like the way you presented the facts.
Thank you.
And I like your facts as well, because there's a lot of them fly in the face of what we've been taught. And I love the way that you presented some facts as questions. It's sort of phone on from what you've done in the book. You don't want to upset anyone, you know. So
exactly, yeah.
You want to retain your license, so you've posed things as questions. So yeah. Another thing which I've sometimes used, people have told me that,
yes,
and then you can say whatever you like.
Yeah.
Or people say that. Rumor has it, and then you can say anything. Yep. You can't be had for slander or anything. It's not coming from me. It's coming from someone else. No, it's been very enjoyable having you on. Thank you so much.
I did enjoy it very much. And I mean, there's so much more. If you want to go into a detail at some point, then I'm more than happy to come again, because I think you do such an amazing work here by bringing things to people's attention that they haven't thought about before, not in their slightest dreams. And so it's important to build this foundation, to build this community and spread the word, so that, as I said in the interview, it can only come from the patient. It will not come from the establishment that we will get change. And so having someone like you doing what you're doing, I think this is absolutely phenomenal. So thank you for that.
More and more people are taking control over their own lives.
That's the point. Yes.
And
that's where we need to go back, and that's the real challenging thing with doctors and dentists, isn't it? Because you go to the man in white and he knows it all. Yeah, rubbish. He is brainwashed at university, and that's about it. That's how we learn. I mean, come on. If you've been in school in chemistry, you know mercury is a neurotoxin. Full stop. But if it's into your mouth, all of a sudden it stops. It's still a poison before it gets into your mouth, because it comes in with a skull bone and a cross into the practice. Yeah. And it has to be disposed as hazardous waste when it leaves your practice. But as long as it's in your mouth, it's absolutely fine. No problem. I mean, really?
Really? Okay, so if we did another SAMR, could we go into the science more? We've done the surface now. We've done the enamel. Okay. So maybe we can go into the science, because you have simplified things a bit. Maybe people do deserve to know more in depth. So let's say we give it a few weeks or a few months, and I'll tell Nick to contact you when it's least convenient to yourself. We'll try to arrange.
I mean, it took us quite a while to arrange it anyway, didn't it?
Yeah. No, he's tenacious, if nothing else.
Yeah. And just let me know where you want to go into specifics, because I don't know out of my head a lot of scientific. So I then want to really bring it down to that I can say, okay, this study from there published in, and then we can do that. So I need a bit of preparation for that.
understand. Well, in that case, why don't we pose this question to our viewers?
Yeah.
Things that we haven't covered with regards to anything that happens in your mouth and as a result of what happens in your mouth.
Yeah.
Pass them to Spooky2, support at spooky2.com. Throw it at them. They get everything. And then they'll pass it on to Nick and myself, and then we'll pass them on to Dr. Elmar Jung, and then we can put something together and we'll put it all into a nice package. Maybe we can do a PowerPoint or something. That could also help.
Absolutely.
Yeah.
No idea how that works technically through a webinar, but yeah, we get that. It's a good experience for me.
We've done a few. We share the screen and then you just go for it, and and your face becomes a little box in the corner, and you just go for it. It's easy. If I can do it, anyone can do it, and I've done it.
Okay.
Have a fantastic evening. Evening, morning.
Well,
or evening.
It's still the morning. It's 11:30, so
Okay.
I'll have the day in front of me.
I hope I haven't ruined your day for you.
No, you haven't. It was great, and thanks to Nick for all his effort. That was absolutely fabulous. How he's really on it.
Okay, I'll pass on those thanks. Well, he edits the movie, so he'll see it first.
Okay.
Okay, you take care.
Thank you very much.
Okay.
Bye, John.
Bye-bye.
Bye-bye.
Bye-bye.